Ultrasound has really revolutionised the way that doctors treat varicose veins and related conditions. We do not use just an ordinary ultrasound machine, the machine you might be familiar with for diagnosing gallstones or looking at pregnant mothers and their babies. This is a special sort of ultrasound called duplex. Now, what do I mean by duplex? Well, the ultrasound builds up a picture of the structures, the blood vessels, the veins, so that we can see it on the screen, but it then also superimposes the flow of blood and the direction, so we can tell where there are problems with the veins, whether there are blockages, whether there are problems with the valves, and whether the flow is in the wrong direction, so-called reflux. When you come for your scan, the whole leg will be scanned from the top of the thigh downwards towards the ankle, even if the vein problems seem to be confined to one area. A water-based gel is used to allow the sound waves into the leg so that a picture of the vein and the blood flow in it can be built up. In this scan, we are looking at the top of the leg where the main superficial vein joins the deep vein in the groin. And you can see the delicate little folds in the lining, which in this case are not meeting properly, and so when I squeeze the leg, blood will go up, which is the correct direction, but when I let go, because the valves are not meeting properly, blood comes down in the wrong direction. We call that reflux. The ultrasound equipment is configured such that blood flow going up the leg looks blue on the colour duplex, but when I let go, there should not be any colour because the valve should be shutting and there should be no downflow of blood. But in this case, we can see that blood is coming down in the wrong direction and it shows as a red signal. In this scan, red on the duplex ultrasound scan shows us that there is reflux, and it shows us exactly where that reflux is coming from.